Kingsley, you talked about how the nurse specialist role has developed in haemophilia nursing. Do you think that that is de-skilling the medical staff?
That's an interesting question, Kate, and I think to a certain extent, yes, because the nurse role has expanded so much that probably haemophilia centres or the care and management is being led by nurses, and the registrars who are training to become consultants are probably spending more time looking after white cell disorders than the inherited bleeding disorders such as haemophilia and, as you know, all the other rare conditions like Glanzmann's, and they just won't see these patients during their short journey through the haemophilia centre. And I agree entirely that there'll be possibly a cohort of new consultants coming through who've had little in the way of experience compared with perhaps some of the older consultants who've been in haemophilia for many, many years and to know everything there is to know about haemophilia dosing and dosing regimens. So I think you're right.
And so to try to improve the education of the doctors without taking away from patients seeing people that they know, or having to see a different doctor every time they come to clinic, have you got any ideas of how we can improve the service for both doctors and patients?
Well, I think haemophilia care is essentially a multidisciplinary role, if you like, and everybody has their job to play, and I don't think it's a one-person job. So, for instance, clinics should be multidisciplinary. We'll have the doctor, the nurse, the physiotherapist, the psychologist, if you're lucky, depending on the resources of the trust. So I think that's the way that it'll improve. Then each person will learn from the other. We can't possibly know everything about perhaps the molecular level science behind new generation products. We know something. However, we can all have our very important input, and it's for the care of the patient. I mean, they're the sort of crucial element that perhaps we forget. I mean, there's training for patients and children that I think falls short of the mark sometimes, as you know, and that's not because we perhaps don't realise it's required. It's just it fails to happen in clinic because maybe there isn't a nurse there to give it, a nurse not to go to the school, to visit the patients at home, to see them in their sort of normal environment.
And so is that an area where you think nursing could develop further?
Absolutely. I mean, community care for haemophilia is the poor relation, really. I think it's a role that needs to be expanded along with hospital management. How that's going to be funded, that's difficult to say. I mean, with the changing face of commissioning, we're going to have to put a good case for providing community haemophilia nurses. I mean, commissioners are interested in outcomes and saving money. Now, to put a business case forward to say that by providing a community nurse we're going to save money is very difficult. However, the outcome might be better, quality of life, better education.
And how might we be able to assess that?
Well, I think you'd be the person to say that. We need more studies, don't we? More outcome measures, more nurses doing little research projects to highlight the uptake of education, for instance.